Okay, we're back again. This is the slide we left off on in part one. And a couple of things that this particular slide is showing you, is not pointing out. You do have, so you do see the maxilla there. The maxilla is are the paired bones that make up the roof of the mouth. So the anterior portion of the roof of the mouth, the hard palate, and it provides a place for insertion of teeth, of your teeth. And then this particular image is showing you the palatine bone. That's the posterior portion of the roof of the mouth. And then the other thing that this is showing you, and we'll see it again, that purple, kind of purplish sphenoid bone, that houses the indentation, or the place where you have the pituitary gland. We call it, it's a saddle shape called the stella turcica. Sella turcica. And it, when we have a side view, it'll show up. It's a important process, I guess you might say. And then I was talking about the white portion on this, that's the occipital condyles, and that's where the skull is going to sit on the vertebral column. That's where the skull sits on atlas and articulates with the vertebral column. Let's see, what else do you have on here? You have places for ligaments, you have places for muscles, and then you have places for the cranial nerves to come out. The cranial nerves are actually nerves that come off the brain stem, but exit via the cranial cavity and become part of the peripheral nervous system. And that's what these, where you have this trigeminal nerve, this facial nerve, where you have the glossopharyngeal vagus, where you have these names, and then you have the Roman numerals after. They're talking about cranial nerves there. We'll learn about that later in the semester. And so the other thing I want to say is all of these skulls are will maintain the same color of the bone going through all the different images, or the different ways of looking at the skull. So you can see via your book how, if you turn the skull, what a bone looks like from another perspective, which is a great thing to do. And so the bulk of the information here is, how do these bones relate to each other? So where are they in relationship to each other? And that it's a better thing to see, certainly to see in lab if you can, or if you happen to have a skull at home. If you aren't in a if you're in a virtual lab, then try to use the book as much as possible, and maybe you can run into a skull somewhere, wherever you do go, if you don't come to campus. And then this one is a close-up on the orbital complex, and this shows you the bones of the nasal cavities, but mostly the orbital cavity. Very complex in terms of the bones that come together to form the eye socket, and again, you're seeing the purple colors, the sphenoid. Then you have your zygomatic bone is the blue. You have your temporal bone, and even the frontal bone coming in here. A little bit of the maxilla, and then some of the ethmoid also in the greenish color. A little bit of the ethmoid bone coming together. All this coming together, and you have, as we've talked about already, a opening or fissure for the optic nerve, and then also another opening or fissure because you have blood flow, great amount of blood flow to the eye, which will be one of your special sense organs. This is the image of the sinuses. And they tend to be something that it's interesting to ask a question about, or learn more about, because certainly there's a great amount of people who have sinus problems, and these are in the bone. So this picture is approximating where these sinuses would be in relationship to what you see when you look at somebody's face. The largest ones tend to be in the frontal bone. We call them the frontal sinuses. And what sinuses are cavities in the bone, so spaces in the bone that decrease the weight of the bone. And also they're lined with mucous membranes. They modulate our voice, so they modulate our speech, but lighten the skull, and there is a drainage. So the mucous membranes they're lined with mucous membranes because they do have an opening to the outside world because they drain via the nose, so they can clearly they can inflame and become the drainage can become questionable, I guess. You have the frontal, the ethmoid, the sphenoid sinuses, and then the maxillary sinuses, all basically around the nasal area. That's why we call them the paranasal sinuses. This one, not so much. Well, actually, this shows the sinuses in the bones, so that's kind of a nice thing to see. You see the frontal sinuses. They don't look quite as big on this one as in the one that we used before. You also see the big sphenoid sinuses. You don't see too much of the air cells in the ethmoid. And then you also have the palatine bone here, and the maxilla in terms of the bony palate. So this one, it actually does show that it is an opening in the bone, sinuses, sagittal view of the sinuses. This is also showing you the turbinates in the nasal cavity. That's what the nasal conchae is. And that is made the superior and middle. And then you have the inferior one, the inferior nasal conchae, and what these are turbinate areas. You can see it probably better from a A to P view, where you actually have bony structures that cause the air as you breathe in to swirl, kind of like a little whirlwind. Keeps it swirling in there so that the hairs can pull out what the hairs can pull out. The mucous membranes can warm the air, or actually the vascularization can warm the air, and any chemicals can be dissolved in the mucus, and that information can be sent up to the brain to see what you're smelling. Moving on to the infant skull, which we've talked about a little bit already. We've already talked a little bit about the infant skull in these fontanelles. And here you have one image. I think there in your book you have a superior to inferior view, and you might have an inferior to superior view also. This is a lateral view of the skull. And what happens, and actually these particular bones are already a little bit more remodeled than a newborn, but the infant skull grows very rapidly. It's important it does, because the function of the skull is to protect the brain, and that can't protect the brain unless it's fused together. So the infant has a large head compared to the rest of the body, because although these bones are going to remodel and slightly change shape, you can tell the parietal, the frontal, the temporal, the zygomatic arch, the nasal bone, all of it you would recognize even if it didn't have those labels on it, because the bones already kind of look like what they're going to look like when this little infant becomes an adult. So the skull grows rapidly, and what's going to happen is that parietal and that frontal bone are going to remodel, as I say, with ossification centers and come till they butt against each other, have that fibrous connective tissue, and that's going to make the suture. It's actually going to make the coronal suture. And then you have the parietal and the temporal bone doing the same thing, and the parietal and the occipital bone doing the same thing. We call these areas where you have a cartilaginous or fibrous connective tissue between the bones soft spots or fontanelles. So fontanelles are areas of fibrous connective tissue. They cover unfused areas. So they cover the areas until the bones can grow. The whole reason for this is for flexibility of the skull during childbirth, and clearly not complete at birth. Generally takes about a year and a half for the entire skull to fuse. So you have the side fusing first, the posterior aspect fuses, and then it's that anterior one that fuses the last on fontanelles. And I did give you the superior view, and so you see that anterior fontanelle is the largest. It tends to be the last one to fuse. And this slide reiterates what sutures are made by what bones, and also kind of shows you an interesting design of the bone, in the fact that you have probably solid diplo bone, and then so the body of the parietal bone, and then you can see these lines where the bone is actually in the process of redesigning, of growing. Moving on to the next topic, we probably won't get too deep into this until the next teaching time, but the next topic is the vertebral column, and I think I got most of my image on here, not all of it, but the vertebral column, remember that skull is going to sit atop the vertebral column just by the grace of those occipital condyles. And that whole skull complex, as well as the brain, is all going to be held up via muscles, and all on the weight of this particular column, which we call the vertebral column. It's one reason why posture is really very important, because this is a great design as long as humans hold themselves at a optimal posture for that weight distribution. So anyway, vertebral column is made up of 26 total bones. 24 of those are vertebrae, and then you add the sacrum and coccyx. So 26 bones, 24 vertebrae, sacrum and coccyx. And sacrum, by the way, can also be pronounced sacrum, so any way you want to pronounce it, you're welcome to. With regard to those 24, you have 7 in the neck area. We call them cervical vertebrae. There's 7 in the neck area, cervical vertebrae. 24 in the thoracic area. That's the thoracic vertebrae. 12, sorry, I said 24. 12, I was looking at my time, I'm sorry. So 7 in the cervical, 12 in the thoracic, and 5 in the lumbar. And then the sacrum and the coccyx bones start out as segments, but fuse into one bone each. We will leave it there and pick it up right here in the next teaching time.